Yolanda. I'm a nursing student today. I'm going to be working with you today. I'm going to go ahead and provide some privacy before we get started. I'm going to perform my hand hygiene, and I'm going to go ahead and grab some gloves, okay? Alrighty. Can you verify your name and date of birth for me?
Susan Carmichael, 2/15/87.
Okay. Awesome. All right. Do you have any allergies that you're aware of?
No, ma'am.
Okay. Are you in any pain at this moment?
No, ma'am.
Okay, awesome. Okay, I'm gonna go ahead and give you a short summary of what we're gonna be doing today. I'm just gonna be doing a dressing change on you. I'm going to draw some labs and administer some medication to you. Is that okay?
Yes.
Okay. All right. I'm gonna go ahead and elevate the bed. Comfort. All right. I'm also gonna go ahead and gather my supplies. I have everything here: my gloves, my dressing change, my chlorhexidine, also a mask for you and for myself as well. Got my flushes medication, and I got my labs ready so that when you do the labs, okay? Is that
Okay.
all right?
Okay.
Okay, I'm gonna go ahead and I'm gonna put a surgical mask on you first before we do any dressing changes. All right. Okay. Go ahead and put on some clean gloves. So that I can remove your old bandage and your old dressing. Right. Alright, so I'm gonna go ahead and assess your site for any drainage, any redness. Alright, and everything looks good. I don't see any drainage, I don't see any redness. Now I'm gonna go ahead and measure your site just to make sure there's not any migration, that everything is still in place. Okay. Alright, awesome. Everything seems to be still in place. No migration. Alrighty, I'm gonna go ahead and remove these gloves. Now that we've checked for migration, I'm gonna apply hand sanitizer on, do my hand hygiene, and then I'll go ahead and put my sterile gloves on so that we can go ahead and start the fresh new dressing change, okay?
Okay.
All right. Okay. So now that I've got that done, I'm gonna go ahead and get you cleaned up with the chlorhexidine. And I'm gonna go and I'm gonna start cleaning in a back and forth motion for about 30 seconds. All right. Okay. And we're gonna allow that to dry. Okay. All right. Now that it's dry, I'm gonna go ahead and apply your impregnated microbial, antimicrobial dressing. Okay. ahead and place your transparent dressing over the insertion site. Okay. Alright. And I'm going to go ahead and label with my initials, the date and time. Okay? Alright. And I'm now going to remove the steel glove. Here, I'm going to perform my hand hygiene again. Okay. Okay, and I'm going to go ahead and verify your prescription again for your blood draw, just to make sure. Alright, which labs are ordered so that we get everything done correctly. Okay, we got a CBC workup on you. Okay, we're going to get that done. Can you just verify your name and date of birth once again for me, please? Okay, great. Alright, I'm going to go ahead and put on some fresh, clean gloves. There's no infusion running, so we don't have to worry about any of that. Okay. So now we're going to go ahead and clean your lumens. We're going to first take the tubing off, cap, so I can clean it. And I'm going to clean the hub. Alright. With some antiseptic for 10 to 15 seconds. Alright, I'm going to allow that to dry. Okay, and I'm going to go ahead and do a flush. Alright, I'm going to disconnect this. We're going to clean the hub again. 10 to 15 seconds. Circular motion. Allow that to dry. Okay. And then we're going to go ahead and draw back 5 ml of blood. Alrighty. And we're going to discard this. We're going to clean the hub once again. Circular motion, 10 to 15 seconds. Okay. We're going to go ahead and do another flush. Okay. We're going to do another hub, clean the hub, 10 to 15 seconds. All right. Now I'm going to draw my sample. I'm going to go ahead and put my syringe in, draw back a little, make sure I have, okay, good aspiration going. So I'm going to pull that 10 cc of blood. Place it here. And then I'm going to go ahead and clean the hub in 15 seconds. Alrighty. I'm going to go ahead and flush. 10 cc of saline. Okay. Go ahead and remove that. Alright. And I'm going to go ahead and, at this time, put my blood in the tube, in the tubing. So So here's my blood. I'm sitting at 1, 2. Okay. My tubes are labeled. I'm going to go ahead and place them in the bag. Sealed and labeled. Alright. I'm going to go ahead at this time and clean the hub again. 10-15 seconds. Alright. Now that's drying. I'm going to change my gloves. Hand hygiene. Alright. Now I'm going to go ahead and verify your medication, prescription. Alright, I got everything verified. Okay. Can you give me your name and date of birth again?
Susan Carmichael,
Okay.
2/15/1987.
Okay, great. So I'm going to go ahead and give you your lorazepam. The doctor ordered some lorazepam, 1 milliliter, just to, calm you down a little bit for your anxiety. All right, so I have everything I need. I assessed the site for any phlebitis, no swelling, no infection, no redness. And I'm going to go ahead and your medication is not expired, it's not tampered with, okay? So I'm going to go ahead and draw up your medication. I'm going to clean the hub of the medication. 10-15 seconds. Allow it to dry. And then I'm going to draw your medication. Alright, we're giving you 1 ml of lorazepam. So I got that. I'm going to recap. Got that ready for you. I'm going to go ahead and clean the hub once again. 15-20 seconds. Alright. Okay. I'm going to go ahead and attach the medication. Okay, and I'm just going to pull back a little bit, aspirate a little bit to make sure that we have a good pull, and we do. Alright, and then I'm going to go ahead and just administer the medication for 1 to 5 minutes, slowly. Alright, so we've administered the medication slowly. We're going to go ahead and discard that and go ahead and clean the port. 10 to 15 seconds. Go ahead and attach another 10 cc flush. You're going to flush your port. Okay. I'm going to discard that. Place. Go ahead and clamp off everything. Put your caps back on. I'm going to remove my gloves so that I can document your medication. Alright, patient tolerated the medication after I've observed. Tolerated the medication without any issues. Okay? Go ahead and put your cover everything that's up, cover you that's up. I'm going to be giving you a call light. I'm going to put your bed at the lowest position. Alright, and I'm going to go ahead and finish documenting any relevant information. Patient tolerated dressing change. blood draw, and medication with no issues. All right. You need anything else from me today? All right, at this moment?
No, ma'am.
Okay. Still no pain?
No, ma'am.
Okay, great. All righty. Well, let me know if you need anything, okay? All right. Complete.